Actually, what we did was we measured complement components and activation products in the CSF and also plasma of more than 300 patients with different subgroups of MS, so relapsing remitting or also with progressive MS, and also in inflammatory controls and healthy, so symptomatic, which means healthy controls. And what we found was that within all CIS and MS subgroups, complement activation products were increased in a very consistent pattern. And we mainly found an increase of C3A, C4A, and BA, while in a few subgroups we found decreased levels of intact C4, which suggests compound consumption. And we further found that especially these activation products, so C3A, C4A, and BA, were highest in those MS patients having an intrathecal IgM synthesis, which was in line with our pathophysiological considerations. And what we also found was that especially these activation products were associated with the EDSS in patients with a clinically isolated syndrome, so at the beginning of the disease, and also in MS patients with the future multiple sclerosis severity score. And we further found associations with neurofilament light chain, which is a fluid biomarker reflecting neuroaxonal damage. We found associations with longitudinal T2 lesion volume and including more than 900 MRIs, and also association with contrast-enhancing lesions, and most interestingly also with longitudinal brain volume loss, and also with paramagnetic rim lesions. And altogether we found a very consistent pattern. And for GFAP, we found a bit differing pattern. We found associations with C1q and C3A and C4A, but this would be also in line with studies suggesting that there might be a crosstalk between microglia and astrocytes involving C1q and C3. Actually, in our study, we found strong associations between special complement activation products and outcomes mainly reflecting disease severity, but also disease activity. And of course, the causality is not proven, because we just found associations, but the association patterns were super consistent throughout all these different outcome parameters. So the suggestion that this might play a role is very strong, actually. And we found especially that the early cascade was involved or was most associated with disease severity. Complement system might play or might play a big role, or might have various functions in MS, and especially in compartmentalized inflammation in MS. And what we know that especially compartmentalized inflammation gets more and more important, especially in progressive MS. So especially in these patients, the complement system or complement activation might be an attractive target to inhibit, as we know that especially in progressive MS patients, there are unmet needs in treatment.